the phrase, eating carrots are good for our eyes, or eating carrots would help us see in the dark. But how true are these statements? Let's find out. Hi, I'm Dr. Ritakshi, and in this video we will learn more about vitamin A. So, how do carrots help us with our good eye health? Well, carrots have a compound known as beta-carotene, which, by the way, is also responsible for its orange color. Beta-carotene is a precursor of vitamin A, which helps in overall eye health, and it also helps our eyes adjust in dim light conditions. Vitamin A is a fat-soluble vitamin, which means it can be stored in our body for later use. It has two forms. First is performed vitamin A, and second is provitamin A carotenoids. Performed vitamin A, such as retinol and retinyl esters, are usually found in animal products, fortified foods, and our supplements. Whereas provitamin A carotenoids are found naturally in plant food. Now, beta-carotene is part of provitamin A carotenoids, and they need to be first converted into retinol for absorption. Therefore, performed vitamin A is usually easily absorbed and used by our body because beta-carotene needs to be first converted as retinol and then used in our body. Let's look at some of the sources of vitamin A. Performed vitamin A are usually found in animal products such as oily fish, milk, eggs, and some of the fortified foods. The foods that are rich in provitamin A carotenoids are usually plant-based. So we would find high beta-carotene in red bell peppers and in most of our yellow and orange fruits and vegetables such as peaches, apricots, mangoes, pumpkins, carrots, and sweet potatoes. They're also found in green leafy vegetables such as kale, spinach, and broccoli. Now that we have learned about the sources of vitamin A, let's discuss about the functions of vitamin A. As mentioned, the most important function of vitamin A is our overall eye health, and it helps in our vision. Vitamin A also helps with age-related macular degeneration. Apart from playing an important role in our eye health, vitamin A also stimulates the production and activity of the white blood cells, which means it boosts our immune system. Also, provitamin A carotenoids are antioxidants. Hence, they protect our body by getting rid of the free radicals in our system. Vitamin A also takes part in remodeling bones, regulating cell growth, and also helps in supporting our skin health. So, how much vitamin A should I take? According to the RDA, the recommended dietary allowance, an adult male would be taking around 900 mcgs or 3000 international units, and a female adult would take around 700 mcgs or 2300 international units per day. It is rare to find vitamin A deficiency, but conditions that interfere with normal digestion can lead to vitamin A malabsorption, such as Crohn's disease, alcoholism, and liver cirrhosis. Also, vitamin A deficiency could be found in people who take limited diet, and this could be due to poverty or self-restriction in diet. The symptoms of vitamin A deficiency varies from mild to severe, starting off from dry eyes, dry hair, acne, leading on to some complications in pregnancies, increased risk of infections, and there could also be causes of infertility. Going to severe, we could have night blindness, and in very severe cases, complete blindness. Just like deficiency of vitamin A has a negative effect on our health, taking too much of vitamin A is also dangerous. So, there is a toxic level or a tolerable upper limit of vitamin A that can be consumed per day, which for an adult is usually 3000 mcg or 10,000 international units. Vitamin A toxicity can usually cause liver damage, vision disturbances, nausea, confusion, and sometimes even death. It's not very easy to get toxicity of vitamin A from our beta-carotene sources. However, it is possible when we consume too much of performed vitamin A. But most commonly, it is linked with excessive intake of supplements. Now, you remember that vitamin A can be stored in our body for later use. So, taking vitamin supplements and consuming performed vitamin A, these could all accumulate and hence reach the toxic levels. Therefore, you should never consume supplements and vitamins until and unless there is a deficiency, or your doctor and your nutritionist or dietitian has recommended you one. Eating a balanced diet with lots of fruits and vegetables and a few animal sources should be sufficient enough. So, overall, vitamin A is an essential nutrient which we need for our eye health, for our immune system, and for its antioxidant effects. So make sure to include all these colored vegetables to your diet. Thank you for joining in and watching this video on vitamin A. I hope you guys found this helpful and hope to see you in the next video with more information like this. Don't forget to subscribe and press the bell notification button so you are updated whenever I post the next video. Thank you. See you.